Good evening, everybody. Welcome to another Rawls MD webinar. This evening it's Decoding NeuroLyme, and I'll be your moderator this evening. My name is Tim Yarbrough. Dr. Rawls will be joining us in just a little bit to share his presentation with this really important topic, NeuroLyme. It's something we hear a lot about at Rawls MD, so we know a lot of you are struggling with symptoms like brain fog, Bell's palsy, even things like depression and anxiety, nerve pain, numbness, really some of the most challenging aspects of Lyme, according to a lot of people. So we hope this is going to be a really helpful webinar for you all to make some sense of things and simplify how you can accelerate your path to recovery. And we're really looking forward to sharing this with you tonight. So these are some of the topics that you all sent us that you wanted to understand more about with NeuroLyme. So you can see it's a lot of different things, involves diet, involves supplements, different symptoms, herbs. So it's a really broad topic, and we're going to do the best we can to simplify it and answer as many questions as possible. We're definitely not going to be able to get to everybody's. We had a huge response tonight for the webinar, so we'll do as many as we can. And we encourage you to sign up for the newsletter at Rawls MD or visit Rawls MD and check out articles there and past webinars. That's another place that'll provide a lot of answers. But tonight it's going to give you a great foundation on NeuroLyme, also called Lyme neuroborreliosis, or you might hear us refer to it as LNB tonight. So if you see that, that's what it is. And stay tuned with us. We will have an in-depth presentation from Dr. Rawls, and then we will have a Q&A featuring your questions that you submitted before tonight when you registered. Also, if you didn't get to submit your questions beforehand, you can feel free to submit those to our chat moderators that are manning the stations this evening. Just note that we've got a large audience, so we may not be able to respond to everybody. And also, since we're not a medical practice, we can't respond to personal, specific medical questions. So if you can, help us by avoiding those, and also keep it brief, please. Dr. Rawls, many of you may know already, but I'll give just a brief introduction and let him tell his story here in just a moment. He is the medical director and co-founder of Rawls MD and Vital Plan, and he is the author of best-selling book, Unlocking Lyme. He's written about Lyme, of course, but also a lot of other important holistic health topics like fibromyalgia, chronic fatigue syndrome, and a whole variety of other topics. So he's really passionate as someone who's been through chronic illness himself. He was featured on the People's Pharmacy, and he's dedicating his life to helping people accelerate their path to recovery. So I can't wait to have you get to hear from him in just a moment here. Dr. Rawls, I believe we're ready for you to join if you're ready to join us.
Thank you, Tim. And welcome, everyone. Thanks for joining us. I'm Dr. Bill Rawls. For those who don't know me or know my story, I've been a physician for 30 years, but I've been working with Lyme disease for at least 10 of that. Mostly because my life was derailed midstream by Lyme disease and chronic Lyme when I was in my late 40s and early 50s. And it was catastrophic. I had experienced most symptoms of Lyme disease, including the whole range of neurological symptoms. I did not find solutions with the conventional route and ended up using herbal therapy and alternative therapies to restore my health. And I found that it's a unique pathway that when someone dedicates themselves to restoring the capacity of the body to take care of itself, then it's possible to get well. I'm 60 now. My life is quite a bit different, and I've spent the rest of my time in my medical career helping others find that pathway, because it's such a misunderstood illness. The neurological aspect of it is as discomforting and confusing as any other aspect. So, but So we're going to hit that topic tonight. This is going to be an overview lecture. There's a lot of information to cover. There's no way that I can cover every single aspect, but I'm going to try to hit on as much as I can, and then we'll have some questions at the end. So moving along here, we're going to start with a poll just to find out a little bit about you guys, so I'll know something about who I'm talking to here.
Yeah, so just what percentage of your Lyme symptoms would you say are neurological? Just cast your vote there. Make sure you hit submit. You may need to scroll down to see the submit button depending on your screen. This is always an interesting question to ask folks, and we love knowing just a little bit more about who the audience is this evening. As you all know, there's a kind of a core of common symptoms, but how big a role neurosymptoms play in each person's illness is different. So just another minute here, if you would, cast your vote. We'd love to be able to have that included here, and then hit submit. And then we'll let Dr. Rawls say a little bit more about diving in here on this topic. Okay, we'll go ahead and close that, and looks like about 75% of our audience's symptoms are Lyme, are neurological, and then 50 came right after that. So pretty high amount of neurological symptoms. All right, Dr. Rawls, I'll pass it back to you.
All right, thanks, Tim. Yeah, and when you look at Lyme disease, it's a complex illness, and it is a little bit different for every person. I think everyone that we talk about with Lyme disease has experienced some neurological symptoms, but certainly there is a percentage of people that have a higher proportion of neurological symptoms. About 15% of people that contract Lyme disease are considered to have predominant neurological. But this is referring to acute illness. And as we talk about this, we're going to find that acute and chronic are two very different things. So acutely, Lyme disease is an infection with a microbe called Borrelia. Most commonly in this country, Borrelia burgdorferi, but there are quite a few other species, at least 12 that we know of worldwide, with a prevalence of several other species in Europe. And also, we're finding more and more that the other species of Borrelia are fairly common in the United States. But classically, it was named from a bacteria called Borrelia burgdorferi, started in Lyme, Connecticut, but we know now it's been around a long time and is quite a bit more complex than just that story.
And Dr. Rawls, I forgot to mention earlier, you should have mouse control now. Forgot to mention earlier to everyone, there is going to be some in-depth information here. So if it's hard to follow along, don't stress at all. We are going to be sending you a replay in the next couple days, and also there's going to be a PDF that we'll send to you right afterwards that'll have names of some of the herbs and other recommendations Dr. Rawls gives during the presentation. So just wanted to mention that. Go ahead, Dr. Rawls.
Yeah, thanks, Tim. Yeah, we've made up a handout with some of the more detailed information, more in depth than just the slides, so you don't have to pull out a pen and paper. All of that information is coming to you. So classically, acute Lyme disease with predominance of neurological symptoms is called Lyme neuroborreliosis. And the most common symptom of that is Bell's palsy, paralysis of the facial nerve, which causes a face droop. It looks like someone that might have had a stroke. Fortunately, it's not permanent. It does gradually resolve over time. And radiculitis, that's basically an inflammation of the nerve roots going down into the lower spine and legs. So low back pain, radiation down into the spine, tingling, numbness, muscle weakness, and some people for a period of time can even be confined to a wheelchair because of that. So those are the predominant acute symptoms. When you move beyond acute and into chronic, A lot of people don't have those initial symptoms. In fact, they are relatively uncommon. And many people who define themselves as having chronic Lyme disease with neurological symptoms never had, don't even remember a tick bite, and develop a wide range of symptoms. So some of these symptoms can occur acutely. Headache especially is one of the most common, neck pain, but you can have a wide range of symptoms from the entire neurological system being inflamed. Brain fog, tremors, cognitive dysfunction, and it certainly affects our emotions. You can have muscle weakness and also loss of motor control. So there is a very, very wide range of symptoms. It can affect the vascular system. So stroke is possible, but fortunately very rare. There are several mechanisms by which the microbe is causing these symptoms. One is meningitis. The meninges are the membranes that line the brain and the spinal cord. So if you get inflammation of the meninges, it irritates or inflames everything. But I think this is a good opportunity to differentiate this microbe from other microbes. You know, classically, most people think about meningitis as being a life-threatening situation. But here we're talking about a microbe that's not nearly as virulent as the classic microbes that cause meningitis. Meningococcus and Streptococcus pneumoniae are the most common causes of the life-threatening version of meningitis. And you know, those would be associated with pneumonia, strep throat. So there's some pretty bad actors. Borrelia isn't nearly as potent as that. It's a lot more stealthy in its nature. So it's typically not a life-threatening infection. So if you get meningococcus in your meninges in your spinal column, you know, you can think of it as being a really bad strep throat or pneumonia in your spinal column. So yes, that can be quite devastating, but typically the infection with Borrelia is not as much. We see demyelination. What is that? Well, basically, all your nerves are like copper wires, and they have to be insulated or they short out. Just like if you had a bundle of copper wires, if you don't have plastic around each individual wire, they won't conduct the electrical impulse, and they will short out. Same thing with your nerves. Your nerves have to have this fatty sheath wrapped around them called myelin, and the myelin acts as an insulator so that the nerves work. So the microbes actually like to use myelin. They need that as a resource. That's one of the things that they're looking for. So when the nerves are infected, it's like they're moth-eaten. So you have some shorting out. We see this same phenomenon to a larger degree in multiple sclerosis, of course, but you see it in other things beyond multiple sclerosis, including this Lyme neuroborreliosis. In addition, you have infiltration of white blood cells into the roots of the spinal cord, and all the inflammation, for the generation of white blood cells, the inflammatory response. The white blood cells are generating inflammatory cytokines to confront this infection that's going on. So you can find these inflammatory cytokines in the cerebrospinal fluid. Vascular inflammation, the blood vessels get inflamed. And sometimes you can find the spirochetes in the spinal fluid, but we've just presumed that in these cases that they are actually invading into brain tissue and nerve tissue. That little spirochete, you know, it can bore right into things. So, diagnosing NeuroLyme. What we're talking about here is mainly diagnosing acute NeuroLyme, the acute infection of the microbe. And you know, to get a firm diagnosis, you have to have a positive test for Borrelia. That can be an antibody test called a Western blot, or it can be test for DNA from the microbe with a testing modality called PCR. Both of those qualify. There's some other newer tests that are coming along too, but the testing is best in acute infection. Once the immune response is attenuated and once those microbes are kind of situated into the tissues, then it's more difficult. Also, another qualification for a true diagnosis is having bacteria in the spinal cord. So, hey guys,
through an accident.
My slides are kind of going crazy here. Yeah, okay. But just a predominance of neurological symptoms and history of tick bite or other symptoms of neurological Lyme should certainly open up the possibility to think about that. Treatment for acute infection predominantly. The CDC, Centers for Disease Control, doesn't recognize chronic Lyme and suggests that any symptoms that are occurring beyond several months are not being caused by the bacteria. Europe, they treat it a little bit more aggressively and recognize that the bacteria does hang around longer. But in both cases, neither groups recommend long-term antibiotic therapy. The European guidelines use intravenous antibiotics. The latest postings on the CDC website don't say anything about IV antibiotics. Different physicians are doing different things, and it's there's a lot of controversy as to what is the best option here. Studies do show that acutely or chronically oral antibiotics work as well as intravenous. Overall, there's not a lot of evidence that using long-term antibiotics for chronic Lyme, though, really does anything. And we'll get to why that's the case. But Cochrane Review is a very prestigious think tank that reviews clinical information, reviews all the evidence of studies, and they have reviewed all the studies that have been done so far. This is current information. And so far, there's not any documented evidence that long-term antibiotic therapy for any form of Lyme disease has any benefit in controlling symptoms. And there's always that question of why do the neurological symptoms predominate and why do they vary so much? Could be the species. There's some suggestions that the European species are more apt to cause neurological symptoms, but some other species are showing up now that tend to do that more also. Could be the person's genetics. Some people may be more susceptible, and it may be that we're just really diagnosing it more, that people have been ill with neurological symptoms and have been worked up for a variety of things, but nobody really thought to test for Lyme disease. And I think that's as big a part of it as anything, is we're just not testing for it. But then you have to come around to the fact that it's not Borrelia alone. It's never just this one microbe. Anybody that is struggling with chronic Lyme disease knows that they're co-infections, that it's not just Borrelia. Mycoplasma is the most common. You can get it from ticks, but you can also get it from sexual and respiratory contact. It can be there prior to the tick bite and prior to the illness. Commonly, it stays dormant in tissues. And that's true with all of these microbes. They can stay dormant for a long time. Something comes along and tips the balance and they become active. Bartonella, common in cats and dogs. You can get it from ticks, but also other sources, including fleas. Babesia, mainly ticks. The others are mainly tick-borne. Chlamydia, respiratory infections. We're finding that chlamydia is really, really common. And chlamydia and mycoplasma have been directly tied to demyelination and multiple sclerosis. So all of these microbes are looking for the same resources. You got to remember, what these microbes want is to survive. They're not out to kill someone. They are just out to survive and get enough resources to make it into the time that they can pass along to another host. So what they want is collagen, myelin, and things that we've got, and they have to get past our immune system to get them. And if your immune system is robust, that may not happen. But once that whole thing gets going, in addition to all of these microbes, and each of those microbes can all cause very similar neurological symptoms to Borrelia. So now you're talking about not just one microbe, but many microbes that can cause these same neurological symptoms. So how do you know which one it is? Well, it's probably all of them. And once they get going and really just disrupt the immune system, then you have reactivation of viruses. Everybody is carrying Epstein-Barr virus, and most everybody has got several of these others. They can all cause very similar neurological symptoms to the list that we just looked at in the beginning. So now we're getting to the point where we're looking, we're beyond acute Lyme disease and looking at this chronic Lyme disease and chronic manifestations. We're not talking about just Borrelia anymore. In fact, it's probably a pretty minor player at that point. You've got this whole spectrum of microbes that are all looking for your resources. And what has been really obvious to me over the years is it's not that common that people get sick from the point of a tick bite. In my case, I took bad call, didn't sleep for years, was under unbelievable stress, and wasn't eating a good diet. Virtually everyone I talk to has a perfect storm of factors that come together around the time of their illness. So many of us have not eaten, have been living off of an artificial food diet. We have artificial toxins surrounding us in our environment. The whole environment is saturated with these hidden toxins, along with natural toxins like mold in our homes, which has become really common. We're all under more stress than we need to be. We're not active. We sit in front of a computer most of our time. That's how work is done now. So all these stress factors are disrupting immune function. But then there are those people that do get sick from the time of a tick bite. And what I find is most of those people have other stress factors going on. Their immune system is already to the breaking point, and the microbes tip the balance. Occasionally, I have someone that is in very good health, and they reach that point that they have the tick bite and they become progressively ill after that. And I think in those cases, it's not that they got one microbe, but they got a load of more virulent microbes at the same time, and that just throws the immune system into disarray. So when I look at Lyme disease, and I'm looking at something that's quite a bit more complex than just an infection with a microbe. You have all these factors that are disrupting immune system along with the microbes. And once you have the immune system that's been disrupted, that leaves all the microbes in our microbiome. We all have 100 trillion microbes that we share space with, and many of those are pathogens. They're not all friendly. So you have all of these microbes, and those unfriendly, those pathogens that have been suppressed by your immune system and all of your friendly flora start getting active. And they start getting active in your tissues, and they start generating inflammation. So at this point, we're beyond even the co-infections. We've got a disruption of the entire microbiome, and that causes systemic inflammation. So everything from the top of your head to the tip of your toes is affected. Not only the neurological symptoms, but heart and muscles and virtually every system in the body. The gut is always affected. And I think that systemic inflammation, we have so much of our immune system is in the gut. So when it becomes overactive and things get disrupted, you disrupt the barrier between the gut, the inside of the intestine, and the blood. So you have not only foreign proteins that cross over that we call leaky gut and food sensitivities, you've also got microbes crossing over. And in addition, that systemic inflammation affects the blood-brain barrier that keeps microbes out, and so you've got more crossover. So it's not just Borrelia, it's other microbes too. And when you put it all together, I like to think of it as a boiling pot. You know, we all start out with this mild simmer. We all pick up microbes through our lifetime. So many of us have chlamydia and mycoplasma and Epstein-Barr, and I probably carried Borrelia for many years before I actually got ill. But as long as my immune system was healthy, I was okay. But you get this thing going on and the whole microbiome gets disrupted and you've got a real mess on your hands. So we're going to, I'm going to turn it back over to Tim for a quick poll and see if we can identify some other characteristics here.
Yeah, we'd love your vote again, audience. Everyone, if you would participate, we'd love to hear. Have you ever been considered for a diagnosis of neurological conditions such as Parkinson's, Alzheimer's, MS, or ALS? Dr. Rawls is about to talk about some of the potential overlaps here, so we're curious to see how many of you have considered that might also have one of these or one of these instead of Lyme. If you could go ahead and cast that vote once again, just either yes or no, and make sure to hit the submit button. And again, you might have to scroll to see that. And got the majority of people have voted, so I'll go ahead and share the results with you. So 33% said yes, they have considered these alternate diagnoses, and 67% have not considered them.
Okay.
Back to you, Dr. Rawls.
All right. Get my mouse back there. Yeah, it's not uncommon that people get worked up for MS and other kinds of conditions because there's so much overlap in the symptoms. The demyelination that occurs, the buildup of amyloid that occurs in Alzheimer's, so many similar characteristics to all these other illnesses. And I think it's because there's a lot of commonality in causes. In other words, I'm not saying that all Alzheimer's, multiple sclerosis, and ALS and Parkinson's are actually Lyme disease. I'm saying that they can be associated with Borrelia, but they also can be associated with all of these microbes that we've come to be associated with chronic Lyme. So virtually all of these illnesses, we're starting to see connections with microbiome imbalances and individual microbes. Alzheimer's patients, they have found Borrelia in the brains of those folks. They found chlamydia in MS and mycoplasma in MS. Parkinson's has been tied to Borrelia, as is ALS. So there's a lot of commonality here. And I think this boiling pot scenario can be applied to many chronic illnesses. The difference in each illness is what's the spectrum of microbes present, how the immune system has been disrupted, the genetics of the individual might carry them on slightly different pathways. As I said in the beginning, when you look at chronic Lyme, it's really a little bit different for every person. And that's true with all of these other illnesses too. It's never exactly the same. We're just looking for similar characteristics to form a possible diagnosis. I've been looking at the literature for those connections in the scientific literature for a number of years now, and it's really some of the new testing is really starting to show some really interesting information. And two studies that I thought were really landmark in supporting this idea, two independent studies done outside the United States. I think one was Australia and one was somewhere in Europe. They were looking for microbes in the brains of people with illness. One study was MS, one study was Alzheimer's. So these were people that had died of the illness. They took brain samples. And there's a new type of testing called 16S ribosomal RNA that they can separate out microbe from normal human cells, and they can take those little segments and mash them and determine groups, not always specific species, but groups of microbes, what class of microbe or what family of microbes it's from. The findings were, to me, just really startling. In both cases, in both samples, they were able to find not just a few microbes, but the entire microbiome was represented in the brain. Now, of course, a lot lower concentrations than you would find in the gut or anywhere else, but these microbes were present, not just a few, but normal flora and pathogens alike. The same was true in the MS patients. But what was even more interesting were the controls. They had people that had died of something else. They looked at their brains and they found the microbiome represented in the brains of the brain tissue of those people too. I found that fascinating. The difference is we're still trying to sort it out, but it appears that the diseased brains had a higher prevalence of pathogens and higher concentrations of microbes. But it was really interesting, and it supports this idea that we all have microbes in our tissues, and we really depend on our immune system to keep those things contained. The microbiome is much more complex and much more extensive than anybody thought. So when you look at solutions for these problems, you've got to be thinking on a bigger scale. You've got to be thinking beyond how do I kill this microbe, and be thinking of how am I going to restore the capacity of my immune system to take care of these things, to basically put them back in the box. That will require suppressing the microbes, but when you move from acute infection to chronic infection and you have this entire microbiome disruption and all of these pathogens in the microbiome flourishing, targeting specific microbes just doesn't really make any sense. You got to control the inflammation because that's what's causing the symptoms. And you have to restore that barrier between the gut and the blood and the brain. Those things are just really, really important. So we have to look at how do we get past, how do we get this pot back to a low simmer instead of a full boil? I like to divide therapies up into three categories: heroic therapy, symptomatic, and restorative. And the pyramid represents the importance in the recovery process of each of these things. We all turn to the heroic therapies first. When we get sick and we feel bad, we want to go to the doctor and we want to be fixed and we want to have it done and have it behind us. And if you have an acute pneumonia or even an acute meningitis or a broken leg or a heart attack, then that's the right thing to do, because our conventional medical system was designed to manage acute problems, and it does so exceptionally well. When we look at chronic illnesses, though, so much of the emphasis is drug therapy to block processes of the illness instead of actually doing what we want to do, which is restore wellness. So we end up in a state of managed illness. Symptomatic therapies are important. When you look at this healing process for neurological symptoms especially, it can take a long time. We're talking about months and years here, not days and weeks. So symptoms, especially pain and poor sleep, can be really inhibiting. So treating symptoms directly can be valuable, but you're not going to be able to reasonably look at that concept of restoring wellness until you look at how do we put all these things back to normal, back in the box? How do we reverse these processes? So I consider that the most important aspect. Heroic therapies, again, we talked about antibiotics, but there's not a lot of evidence that they work for neurological Lyme or anything else. And it's because antibiotics target fast-growing microbes that are consolidated in one place, like a pneumonia. Antibiotics are life-saving in many, many cases, But when you talk about low concentrations of these microbes that grow very slowly, that are embedded in tissues, it takes a long time to get rid of them. And what happens with antibiotic therapy is you disrupt the microbiome and make the whole process worse instead of better in most cases, so that it's not a war you win in a short period of time. So using acute tools like that isn't necessarily helpful. There are a lot of heroic therapies that are applied, but I wanted to pick just a few. One thing that I think does have value is hyperbaric oxygen. All these microbes are very sensitive to oxygen, and if you can push oxygen into tissues, it can be very valuable in the restorative process. That being said, I list hyperbaric oxygen, and ozone or any of the oxygen therapies would fit in this. I fit that into the category of heroic because there is a certain amount of toxicity with straight oxygen. I don't think you're going to win the battle with that alone, but it can be helpful in the process. A lot of people are using Rife technology. Rife technology is not something that our conventional system has recognized, and therefore there's been virtually no research on it. It may have value. I've talked to a lot of people that have gotten benefit. I haven't talked to anyone that's been cured by it. The problem with it is we just don't know enough. There's really no science behind it, and it's expensive. It can run many thousands of dollars for something that has the potential for being effective. So I put a question mark beside that one. Symptomatic therapies, yes, we do want to feel better, and if we can do things to help the process. So there are a lot of things that we can do. One of the top on my list is CBD. CBD is found in the form of cannabis called hemp. Hemp doesn't have significant amounts of THC. THC is a euphoric found in marijuana, but CBD is present at higher levels in hemp. It is legal in most states. It can be shipped across state lines. You can get it on the internet. It's a booming business right now. There are a lot of different kinds of products, but it can be very, very valuable in helping with pain. One of the things that was really well known about CBD is it was found to have wonderful properties for calming childhood seizures. So we know it has some really wonderful effects on the neurological system. So there's some healing properties there too. I see it as a really important symptomatic though, because it, like many things that are treating a symptom, will lose its potency over time as people develop tolerance to it. So I see it as mainly during the early stages of the recovery process when symptoms are so pronounced, and then less later on. There are a lot of other herbs that can help with symptoms. Corydalis is one that's well known for pain. California poppy is good for calming the nervous system. Many, many others. But I just wanted to hit on a few that I thought were worth talking about that mainly treat symptoms. Others, kava, valerian, have a higher potential for habituation and causing side effects. And then there's the pharmaceuticals. I put a question mark there because it's one of those things that is often necessary. If symptoms are terrible, then drugs. You need something strong. But if you can get by through your recovery process without using extensive pharmaceuticals, you'll be better off. The problem with all the pharmaceuticals that are used to treat neurological symptoms of any type is they have a high propensity for habituation and side effects. Someone habituated to certain types of pharmaceuticals can end up in worse shape than they were with the chronic Lyme. So there's a place for pharmaceuticals, but you have to be really careful with them and respect them. Moving on to the area that I think is so important is just the restorative therapies. And these things do take time. And it is something that this is the part of the recovery that you have to do yourself. It is your personal pathway. You do have to take personal accountability. There are things that you have to do to put your body into a healing phase so that any other therapies that you may be getting outside of that from physicians and others can help with that whole process. First of all is eating a good diet. Now, we could do a whole webinar about diet. We do have a gut program. I've put a lot of work into helping people with diet, but I've tried to boil it down to the very basics. And if I had to do just 3 things, it would be this: eat more vegetables than anything else. There's so many great vegetables out there. Early on, we restrict some vegetables like nightshades and cruciferous because they're hard to digest. Vegetables with high oxalates, we restrict early on. But in the long haul, that should be your goal, eating more vegetables than anything else. The other is, it's not finding the foods with the right ingredients on the label, it's eating foods that don't have a label. And if you shoot for a goal of less than 10% of your food has labels on it, then you'll be way ahead of the game. Processed food products are just are problematic in so many levels, especially the processed carbohydrates. So if you're just eating real food, then you're going to be way ahead of the game. There are a lot of protein sources that are acceptable, but I put fish and eggs as high on the list, especially for neurological, because fish is high in omega-3s, which are anti-inflammatory, especially for the neurological system, and eggs are high in choline, a really important brain nutrient. Of course, some people are going to have food sensitivities, and there's certainly other protein sources that you can use, but I think those are really valuable. Collagen is really important in this whole process too, for the gut, for the brain, for tissues, for joints. So bone broth, and you can get bone broth at any grocery store now. It's very, very available. Having a cup of bone broth a day, even once or twice a day, is really good for you all the way around. You got to take care of your gut. We have a whole gut program, so I'm just going to hit the highlights. You've got to protect the gut lining. You've got to reestablish that barrier. So mucilage helps reestablish the mucus protective coating of the gut, which is found in a number of herbs. Berberine is an excellent herb for balancing the microbiome of the gut. Bitters connect us with our ancient food past. With bitters, the flavor of bitter was so prominent in ancient diets. So taking bitters can propel the normal digestive process, taking enzymes until that becomes reestablished. Herbs that support the liver and reestablish bile flow, like dandelion and milk thistle, and probiotics sometimes. Probiotics are kind of a hit or miss. Sometimes they're valuable, sometimes they're not. We're still learning about probiotics. But getting right down to it, you do have to affect your microbiome and your immune system. And that is just really super important. And that's where the herbs are so remarkably valuable. I found them to be a key part of my recovery. I did all the things that I needed to do to create a healing environment, but it wasn't until I embraced the herbal therapy that I really started making progress in my own recovery. Some of my favorite herbs: Japanese knotweed, cat's claw, andrographis. They've become very well known in the Lyme communities. There are many others, but I consider them kind of a good core to start with. Starting there, and these do cover most of the microbes that we're talking about. They do help balance the microbiome. They do cross over into the central nervous system, but there are many others that you can use to complement that, and I'll mention a few as we go along. You have to balance the immune system. You want to reduce the inflammation throughout the body, and you want to, at the same time, reactivate the immune system so it can start controlling this disrupted microbiome. So there's some really good herbs for that. Reishi and cordyceps are top on my list. Chinese skullcap is another antimicrobial herb that's especially good for synergizing other herbs, and also balancing immune function. Rehmannia is a really nice immune balancing herb, so that's a good start. Neuroinflammation, going beyond just that basic core, essential oils are especially good for crossing over the blood-brain barrier. Many essential oils have antimicrobial properties, but they also often they're also very good for reducing inflammation and restoring normal neurological function. Rosemary is top of the list. It's always been known for enhancing mental function. Frankincense, lavender, lemon balm have some wonderful calming properties. So our brain is on fire. It's irritated, so we want to calm it down. Now, the essential oils for this are best used as aromatherapy because it puts them right where you want them to be. CBD from hemp would be considered an essential oil. It is the herb itself contains terpenoids that are classically part of the essential oil, so it falls into that category. Herbs that are really good anti-inflammatories are turmeric and boswellia. They're well known for not only arthritis but also for neurological symptoms, so they're excellent. And then anti-inflammatory fats, fish oil, krill oil, but you need a significant amount, anywhere from 2,000 to 4,000 in a day. You get krill oil is better absorbed than fish oil, so you don't need quite as much of it. You have to be a little bit careful, especially if you have a history, if you're on blood thinners or you have a history of easy bleeding, because too much fish oil or too much omega-3 fatty acids can thin the blood and cause bleeding problems. So you have to be careful with them. But there's so much good evidence behind the anti-inflammatory properties of omega-3 fatty acids for the neurological system. And then coconut oil, medium chain triglycerides, a saturated fat made of medium chains instead of the long chains that you find in saturated fat that you find in animal sources such as beef and pork. Nice anti-inflammatory properties plus some antimicrobial properties in coconut oil that do cross over into the brain. So you do get some anti-inflammatory and antimicrobial properties with that. So there are other fats. Saturated fat is really nice anti-inflammatory in small amounts. Possibly the best way to get it is a little bit of ghee, like a teaspoon or so of ghee a day. Ghee is clarified butter that's often used in Indian cooking, and a small amount of it has really wonderful anti-inflammatory properties. You have to clean up your life. You know, it's purification is part of the whole thing. Just that healing environment, food, water, air, your surrounding environment. You really have to get rid of alcohol. Caffeine. You know, if your body is not working well and you're driving it with caffeine, then it just drives it harder and ultimately makes you sicker. So I suggest that during recovery processes that people should wean off of caffeine. And I'll have a tip for you with the next slide if you're struggling with that and still need a little bit of a boost. But caffeine during the morning, basically what you're doing is you're suppressing the normal things that put you to sleep. So it makes it more difficult for you to sleep at night if you have caffeine in your system. You're not going to get well unless you're sleeping. Many pharmaceuticals disrupt sleep. So everything from antihypertensives to medications for depression. There's so many drugs that disrupt sleep. So often they become a necessity, but sometimes it's worth a consultation. If you're having trouble sleeping, sometimes it's worth a consultation with a physician just to see if there's maybe some other options. And then detoxifying supplements. Glutathione is really exceptionally good for cellular health and detoxification, along with NAC, alpha lipoic acid. If you have methylation defects, activated B vitamins are really important. And then just other micronutrient support with vitamins and minerals. You got to give your body what it needs to take care of itself. Coenzyme Q10 is really important in the energy process. Vitamin D is important for for immune system functions as well as bone health. 1,000 units of vitamin D is kind of the standard, but the best way to find out about vitamin D is get your levels checked in the summer and in the winter, just to see if you need different amounts. If you're getting plenty of sun in the summertime, if you are getting exposure, you may not need any supplementation at all in the summer. I don't use it ever in the summertime because I'm getting outside. And in the morning, if you're just having trouble getting going, there are a couple of nice herbs that are really good for that. My favorite is rhodiola. Rhodiola is an energizing adaptogen. Adaptogens are herbs that don't have a drug-like effect, but they have an effect of counteracting stress factors in the body. So 100 to 500 milligrams of rhodiola in the morning instead of caffeine can actually give you a little bit of a boost. If you're really dragging and just rock bottom, a small dose of licorice, like a 500 to 100 milligrams, can help boost you, get you going in the morning. And the adaptogens are really good for balancing your circadian rhythm. So doing that in the morning can help balance you out a little bit. You got to be careful with it though. Some people don't sleep as well at night with a morning dose of rhodiola. So it is something just to play around with and try small amounts. The licorice, you generally don't want to keep it going long term. So it's after a couple of months and you're starting to feel better, it's better to start tapering off of that one. The rhodiola or Eleuthera as an alternative are really nice. You can't get well without sleep, and this is a really difficult catch-22 with NeuroLyme or any kind of chronic illness. If your brain's on fire, it's hard to sleep. If your brain is really inflamed, it just can't turn off like it should. So it's, but everything in your body needs sleep. Your brain will not recover without sleep. I'm right in the middle of doing research into sleep. We're going to produce a sleep kit to help people overcome this problem. And it's really interesting how important sleep is. Many athletes are now sleeping 9 and 10 hours because they found it so important in the recovery process. 5 and 6 hours just isn't good enough. You have to sleep more. And so again, that's a whole webinar, one that's coming, but sleep is vitally important. I see so many people that are chasing heroic therapies and doing all these different things. And I ask them, well, how much are you sleeping a night? And they're going, well, about 4 hours is all I can get. And it's like, well, until we can get you sleeping better, you're not going to get well because your brain can't recover, especially from neurological symptoms. So your brain is really active and neurons are producing waste products during the day when your brain is so active. And one of them is amyloid. You have to have, your brain has like a sewage system that becomes active when you sleep that flushes out all these waste products including the amyloid. Amyloid is something that we see in a lot of neurological diseases, but it is also found in one of the key things that you find in Alzheimer's disease. And it's amyloid, they did a study with healthy college students and they found that even one night of sleep without sleep, they didn't clear any amyloid from their brain. So we got to get people sleeping again. That is a key part of the entire recovery process. There we go. So let's see here. Yeah. So there are things that you can do. So helping your brain get well is really important, and that requires relaxation. If your brain is inflamed and driven by adrenaline, it's not going to get well. So doing things to calm your brain. There are many forms of meditation. Open focus is trying to shift your brain from that very analytical thought that we're in most of the time to more abstract thought. Guided imagery carries you through the process. Yoga has so many different meditative modalities to offer. One of them being the bumblebee breath. That's a breath that you use a hum, a raspy hum like a bumblebee sound. And it actually has some really calming properties, but it's been found to be valuable for brain health. And then the herbs. Ashwagandha is probably my favorite. It's another adaptogen. Lots of great adaptogens out there, but ashwagandha has been found to have specific benefit for brain health. L-theanine, it's an amino acid that's found in green tea. It blocks exciting neurotransmitters and has a calming effect. Philodendron blocks some of the effects of adrenaline, so it has a calming effect. It blocks, when your brain is irritated and aggravated, and so that's making you push out adrenaline. That's an herb you can take that helps block some of those effects. And there are many herbs for just brain health that are really important. Bacopa is one of my favorites. It's a calming herb that has been found to increase cognitive function in a wide range of people, everywhere from people suffering from ADD all the way to dementia. Gotu kola is one of the classic restorative herbs from Ayurvedic medicine that has some really wonderful properties for the brain. Motherwort protects mitochondria and increases dopamine in the brain really nicely. And then there are many nice herbs that help clear amyloid. Salvia or red sage is one that helps clear amyloid, but also is a wonderful immune modulating herb. Resveratrol, high concentrations of resveratrol in the herb I mentioned first, Japanese knotweed. That's been found to help clear amyloid, along with just drinking green tea. And then there is lion's mane mushroom. Lion's mane mushroom, like all the mushrooms, has some wonderful immune modulating effects, but it has been found to have specific benefit for enhancing healing of nerve tissues. It increases neurogenic growth factors in the brain and enhances healing. So lion's mane mushroom is a really wonderful. Other brain support, there are various things that increase choline. Choline is one of the main substances that the brain uses for us when we think. So acetylcarnitine helps metabolism of the brain. Acetylcholine is one way that you can increase choline in the brain. And then magnesium glycinate is a calming form of magnesium that is good for all around calming effect, but the glycinate is an amino acid that has a calming effect on the brain. So we want to calm those brain tissues down that have been aggravated and irritated by this whole process. When you look at inflammation from an electrical point of view, it's an electron deficient state. So we know that giving low currents of electricity can actually reduce inflammation. So these are some newer modalities that have been found to actually help with sleep, help with depression, help with quite a number of different neurological conditions. And I think they probably have some application here. There are studies behind these, but not as robust as I hope to see one day. So the potential for harm with these modalities is very, very, very low. The biggest impediment to using them is cost. They can run anywhere from several $100s to $1,000 for these things, but the potential for harm is low. They can help with insomnia and depression. You got to move. You got to generate endorphins to get well. Endorphins are essential for the whole healing process. Low intensity exercise is best. If you overdo it, then you're going to suffer. It's going to actually increase inflammation. Walking is good. Yoga is good. One of my favorites, though, is an ancient Chinese movement art called Qigong that I think you're going to hear more and more about. It's moving energy in the body. It's like self-administering acupuncture and massage at the same time. So it has a lot of value, I think, in restoring movement to the body. Virtually anybody can do it. You can do it in bed. And there are many, many levels of it. It's easy to learn. You can learn it from watching YouTube videos or ordering other videos. They're starting to become, classes are becoming more common. So it can not only help with symptoms, but it also can help the whole restorative process. And here are two I'll mention that I didn't mention previously. Other things, other alternative therapies that can help with the healing process and reduce symptoms are acupuncture, chiropractic, massage therapy. All of those alternative therapies can be beneficial. If movement is limited, infrared sauna can be very beneficial for generating endorphins, but also removing toxins from the body. So the future, as we look at these illnesses more as a chronic immune dysfunction with disruption of the microbiome, and learn more about how these unique patterns that the microbiome can be disrupted for illnesses to occur, I think we're going to start being better able to target things with immune therapy, not necessarily immune drugs, but immune enhancements, and enhancing the ability of our immune system to take care of itself, to rebalance the microbiome. So I think that's going to be very, very important in the future. That's where I'm putting my money as far as aerobic therapies that I think is the most important. Beyond that, stem cell therapy, removing stem cells from our body, concentrating them and injecting them back in the body. We're already seeing a lot of benefit for joints, and I think there's a lot of potential for other kinds of things. Cold laser therapy. Cold laser as opposed to hot laser. Hot laser is a laser that burns. It would burn the skin. Cold laser is using laser energy that is a lower intensity or lower frequency, so it doesn't burn, but it does activate energies within cells, and it can promote healing. It is being widely used for musculoskeletal problems, but I'm also reading about it being used for restorative value in neurological symptoms. I think it has a lot of promise. And then vaccines. There's a lot of work right now to get the Lyme disease vaccine for Borrelia. I think we may have that one day, but I'm a little concerned that like when they tried it before, that we're going to see flare-ups of autoimmune symptoms. And when we start looking at these conditions as a disruption of the whole microbiome, I'm not sure how much value a targeted vaccine has. Vaccines are most valuable for highly virulent microbes. We've done wonders with smallpox. It has some value with influenza, polio. There's so many really bad virulent diseases with really bad microbes that we have been able to control or eliminate with vaccines. But the lower the microbe is on the virulent scale, I think the harder and the more you see chronic illnesses associated with disruption of the whole microbiome as opposed to a microbe, then I think the value of vaccines goes progressively down. So I don't see that as being high on the list as value for the future. So again, just winding things up, there's a place for every one of these therapies. Yes, you want to have a relationship with a healthcare provider. Yes, there are heroic therapies now and in the future that may be valuable. And yes, you may need access to someone to help with symptoms early on, especially. But if you're not building your restorative base, if you're not teaching your immune system and setting up a healing environment in your body, these things are going to have much, much less value. So that's the message that I think is most important to leave everyone with. So I'm going to turn things back over to you for a bit, Tim.
All right, take a break and then we'll get back to the Q&A section, Dr. Rawls. Thanks for that, and I hope that was helpful for really setting a foundation for everybody. That should have answered a lot of questions for folks, actually, a lot of the most common questions, so hopefully it did. And once again, if you didn't get to write any of that down, we're going to have a PDF in the thank you email we send to you right after the webinar, so keep an eye out for that. And then a replay in the next couple of days will also be available because it's dense, we know. Just wanted to take a moment before we do the Q&A to honor Lyme Awareness Month. May is Lyme Awareness Month, and it's honoring all of you that are going through this stuff and trying to raise awareness since it is not acknowledged in so many different places, states in the US and countries around the world that we talk to folks all the time. So we've had a lot of great stories that we've been highlighting this month of inspirational people that have overcome in their journey with Lyme, and hopefully it will inspire others as well that they can do it. So we encourage you to check those out over at Rawls MD. You can see some of the folks here like Stephanie and Ron and Hank. And then if you don't have any support in your area, online support is great, but there are also in-person support groups that you might look for. And also at Rawls MD, we've curated a Lyme support directory, and you can look up your area and see if you've got anything near you. And if you don't and you want to start one, you can always start one and then add that group to this directory. But we know support is really important. You can feel isolated a lot of times. So we hope these webinars are something that kind of reach out and can connect with you and connect you with this larger community. And the Lyme support directory is another way that you might be able to do that. So check out the Lyme support directory. Check out some of those inspirational stories about people that are overcoming it after some pretty rough times, and know that we at Rawls MD, are all here supporting you all, and continuing to do research and put out these webinars to help educate you. All right, well, Dr. Rawls, if you want to come back on, we'll go ahead and launch into some of these questions, and again, we'll get to as many as we can. Thanks everybody for sticking around for the presentation and into the Q&A section. So whenever you're ready, Dr. Rawls, great.
Hi, Tim. What you got for me?
You're back. All right. You ready for some more questions here?
Let's go for it.
Okay. Well, you touched on this briefly, but we had so many people asking about multiple sclerosis. Can you just talk again about what's the link between Lyme, NeuroLyme especially, and MS? And specifically, Deborah wanted to know, can you have lesions with both?
Oh, sure. Well, according to the conventional medical system, there are no links, but I don't see it the same way. Again, it's MS in the conventional community is still considered cause unknown. It's just, it just falls out of the sky and hits people on the head that happen to be unlucky. But when I start looking at it and start looking at these connections with the microbes and the disruption of the microbiome and the effect on the immune system that these microbes have, I can't not see a connection there. So I don't know that it's always Borrelia. In other words, somebody with MS could have a different spectrum of microbes and have never been bitten by a tick bite. And I think it may vary in every person. Genetics may be involved, though we know that it's not exclusively genetically transmitted. But I think the microbes have a definite connection. If you talk to the experts, they say, well, people have those microbes that aren't sick, and therefore it's not related. But as I've said before, the difference is the immune system. And once you get that pot boiling over, I think you can see different manifestations depending on which microbes are present. So you look at it and you look at how microbes like chlamydia and mycoplasma and Borrelia work. And basically, these things are in tissues very extensively. They manipulate white blood cells to generate inflammation. The inflammation breaks down the tissues. Chlamydia and mycoplasma are really small microbes, and these microbes absolutely depend on myelin to reproduce. So yeah, they're going to go for the myelin. They're going to go for the nerve tissues. And again, if you look at it on a scan, it kind of the nerves look kind of moth-eaten. So I can't help but think that there's got to be a connection there, and therefore, treating just the symptoms of MS, I don't think is going to be what overcomes this illness. Right now, the drugs for MS are very limited value. There have been some people, interesting, that have responded to antibiotics, but they lose that response. So that would suggest, but this latest study, finding the whole spectrum of the microbiome present in the brains of people with MS and finding a higher prevalence of pathogens suggests strongly to me that, yeah, this is an immune dysfunction, and more than just a microbe. This is many microbes causing the problem. And so, yeah, you can see some of these same symptoms. In fact, I talk to Lyme patients all the time that, before they found they had Lyme disease or before they were formally diagnosed, they were worked up for MS because they had a lot of the same symptoms. But the nerve conduction test and the other parameters that they have to check off to be qualified for MS didn't quite fit. So many times I've heard, well, they worked me up for MS and I had a lot of the symptoms, but I didn't quite meet the criteria, so they don't think I have MS. And then later they find out they have Lyme disease. There's too much commonality there, just too much.
And another one kind of along those lines, ALS. Barbara says, anything else to add about treatment for severe ALS, like symptoms such as muscle weakness, fatigue, difficulty walking, shortness of breath? So some more serious symptoms here. She says most people talk about brain fog and cognitive issues, which she doesn't have.
Yeah, ALS is a much more progressive. And again, I think at this point we don't know everything. I think we're just learning. I think we're on the edge of learning a lot and having some big breakthroughs. These new modalities of testing that they're able to take tissue and test for a spectrum of microbes. Unfortunately, you got to have a pretty significant block of tissue to do that. So it's really only practical for autopsy specimens, which isn't helping living people, except that we're learning. And if we can learn which microbes are more prevalent and in each of these illnesses and start seeing patterns, then I think that's the point that we can start using more targeted immune manipulations to help rectify that problem much faster. But there is still a lot we don't know. In other words, I'm seeing some commonality between chronic neurological Lyme and ALS, but I think there's some differences there too. Possibly more potent pathogens are prevalent, and a different disruption of the microbiome and the immune system. I think all the things that we've been talking about can certainly be applied to anyone, ALS patients included, but once it is very progressive, it is hard to reverse it at this point. Not to tell people to give up hope. I've seen people to bring things to a standstill, but the earlier that you can do that before the symptoms progress, the earlier the better. But again, the nice thing about the restorative therapies, the herbs, changing the diet, all of these things, they have virtually no toxicity. anyone on the planet can benefit from these things. And everybody on the planet should be doing these things because they are so profoundly valuable. So I have seen ALS patients that have followed that path, that have been able to slow down progression of the disease, but not stop it completely. It's still a very complex and aggressive disorder that we don't know yet enough about.
Mm-hmm. Thanks. And just briefly, could you speak a little bit about biofilm's involvement, role in NeuroLyme?
Sure. There's a lot of talk about biofilms in chronic Lyme in general, that people aren't getting well because they have biofilms, and it's because somebody took Borrelia and put it in a test tube, and they're perfect conditions for biofilm formation, and they found that Borrelia forms biofilms. For a microbe, forming a biofilm or being involved in a biofilm is like bacteria 101. All bacteria can do that. So a biofilm is basically a protective coating that allows a colony, generally not one type of microbes, but many, to protect itself from immune systems in the outside environment. Typically a biofilm forms on a surface. So the plaque on your teeth is a form of biofilm. We all have biofilms in our gut that are protective, especially in the colon. So you have to be careful about how you mess with biofilms. Biofilms can form inside sinuses. Part of sinus disease is that. They can form inside joints, and they can form inside brains, and that is part of the process of Alzheimer's. But when you look at a biofilm, the harm that biofilms do are mostly that they damage the surface that they form on, and they cause erosion on the surface. So that's not classically what the symptoms of Lyme disease are coming from. And I think so as much of anything, if someone has a lot of biofilm in their body, it's showing that their immune system is really terribly dysfunctional. So if you're just going after the biofilm directly and not doing things just to restore normal immune function, you're just not going to get very far. So the only thing that can really properly control a biofilm in the body is your immune system.
All right, great. All right, we're going to see if we can get to several more here. So we'll just be as quick as we can. This next one is, I've heard that garlic crosses the blood-brain barrier, but I can't use garlic. Are there any other good herbs to cross that blood-brain barrier?
Oh, yeah. Most herbs have substances that cross the blood-brain barrier. There's so many wonderful herbs. Garlic's a nice one. Acetylene in garlic, the chemical, the what you smell when you crush garlic is a really nice antimicrobial, especially good for the gut. And it's one that I definitely have on my list. But wow, there's so many good herbs that can be used in neurological Lyme. I've mentioned just a few. There's so many others. I've listed quite a few in the book. And I've addressed neurological issues and inflammation in the book. So there's a lot of information there too. But yeah, there are just so many. Neem is really nice. Some of the herbs that contain more essential oil like neem, oregano, there are just so many options, and they're all valuable. So just using a combination of a handful of herbs, there are many combinations that are valuable.
And I know you always talk about there are a lot that we know go across the blood-brain barrier, but there are probably a lot of constituents that we don't know that are going across that blood-brain barrier. So that's always important to recognize. How about for any additional herbs you might recommend specifically for tremors? That's a common symptom people report with NeuroLyme. Tremors.
Sure. Well, I think an important part of this is the whole thing of, so many people are directing their approach to killing microbes or treating symptoms. And if you're treating symptoms, you're just suppressing the symptom. You're not getting rid of it. To get rid of the symptom, you have to get rid of the cause. You have to restore normal function. So neurological symptoms are some of the most stubborn. It takes a long time for brain tissue to heal. But my experience is personally, and working with so many people, is it will over time. It just takes a lot of time. I mean, I had the headaches, the brain fog, the burning feet, the tremors, the skin crawling, just the weird tingling, and I had the tremor. I started having a head bob that I would just be sitting there doing this all the time. You know, patients would look at me and say, "Well, Dr. Rawls, you're saying yes, but you're shaking your head no." And I started a hand tremor. The thing that really helped that more than anything else rather acutely was glutathione, and that's why I listed as one of the really important ingredients. I'd been using the liposomal glutathione and it didn't do a thing. I started doing a reduced form of glutathione made by a company called Cetria, and within 2 weeks, my tremor cleared up completely. And I'd been taking the herbs, but that was the one thing that I changed that really helped it. And then, you know, you forget about things. Several months went by and I stopped taking the glutathione and the tremor started coming back. Started glutathione again and it was gone within 2 weeks. Now, I'm not saying everybody could have that experience, but it certainly, the glutathione did seem to have an effect for me. Most tremors are associated with dysfunction of dopamine in the brain. So I think dopamine supporting herbs like motherwort are really important. But healing takes time. You know, I mean, it can take months and years. This is a battle that is won with patience and persistence. You just have to keep at it and keep at it, and you will fall on your face and you will have to get back up, and you just keep going. And every month and every year it gets a little bit better. And that's the good news. You know, there is so much that you can do with this condition, and so much that you can do to help yourself. That is really, really important.
Great. And you mentioned several times patients. So there's another common question here about, do you still see patients or do you still consult with people?
You know, I did clinical work for 30 years, and it's pretty taxing, especially with Lyme disease patients, because they take a lot of time. You know, I found that to help patients, what I said to them and the counseling that I did was much more important than any diagnostic test or any procedures. And the system doesn't pay you for talking to people. It's a really frustrating thing about our system. Our system rewards physicians for doing procedures. And the fewer procedures that I did, the lower reimbursements were, to the point that it was really difficult to keep doing that kind of work. And after 30 years, it's very taxing. I found that I can help more people designing systems and programs. It's been really wonderful to talk to different individuals who I've never met before, who have read the copy of the book or done some of our programs or followed our protocols and have gotten their lives back. And, you know, I talked to an individual, a really special individual a couple of days ago that had really pronounced neurological symptoms that this person figured it out. And she said that this person said that through all the people that she had worked with, and I've heard this story over and over, that people see doctor after doctor and professional after professional, and it just doesn't really get them anywhere. And when they take it upon themselves to create a healing environment in their body and really follow the steps that they need to follow, they get well, and it's really remarkable. So if I can write and do webinars and build programs, then instead of a few individuals that I can help with specific consults, then I can help people all over the world. And that's how I found that I can give back the very best. I'll probably still continue doing some clinical work here and there, but right now I'm taking time off from that just to devote to building all of these resources for people, because I think that's so much more important.
Awesome. Yeah, thanks for explaining that. You mentioned your herbal protocol, and we also had a lot of questions about that. Since this is an educational webinar, we don't have time to cover that, but I just want to let folks that are interested know that we will be providing more information to them if they want to learn more about Dr. Rawls' herbal protocol. So you can stay tuned for that. Just a couple more questions here, folks. Last two, really. Dr. Rawls, will peripheral neuropathy, is it possible for that to ever go away, or is that something people just need to expect to live with?
Yeah, peripheral neuropathies are just predominantly sensory, but also they can be motor, but just irritation of the nerves, burning feet, weird tingling, discomfort in limbs, pain. It took a long time. Mine did go away. It was several years of herbal therapy, but I was still learning back then. But I was able to manage all of those symptoms. And I've talked to so many people that gradually over time, again, the neurological symptoms are really stubborn. It takes time. It takes a lot of persistence. But my experience is in most cases they do improve and get better. And the tough thing is dealing with a symptom, and so many people end up on medications that just cover up the symptoms, but inadvertently can even make them worse over time. So it can be a struggle at times, but it does gradually improve.
Good, always nice to hear. And then this one last one, we had so many questions. We focus a lot on the physiological aspects of Lyme, but there's a lot of questions here about emotions, the anxiety, the depression, sometimes even rage. Any advice to offer there about how that's related, or if there's anything different that you would go about, or is it still this restorative?
Sure, it's a combination of factors. I think anybody that is chronically ill, just the frustration of being chronically ill, of being removed from society, of losing touch with community, that in itself can be enraging and frustrating. I had at different points had a lot of anger bottled up just because I was so frustrated with my situation. Here I was, a physician with this, and I didn't have a very good diagnosis. I couldn't declare disability, but I was still having to go to work every day. And you just feel horrible inside, but you can't let anybody know it. And you don't look that bad, you're sitting there. So people don't really know the anguish that you're going through, and that can make you angry. But there's more to it than that, and I think sleep is a big issue. We know that lack of sleep very much profoundly affects the emotional centers of the brain. If you have not rested well, if you haven't gotten 4 hours of deep sleep and a good range of REM sleep for a total of about 8 to 9 hours, you're going to be emotionally very liable and label, and you're going to there's these emotions of sadness and anger and frustration and depression and anxiety are sometimes hard to control. So sleep is a key element in this whole thing. But beyond that, just the brain being irritated is going to affect the neurotransmitters in the brain. So you're going to have a higher prevalence of exciting neurotransmitters that are irritating. And so the whole thing just makes you much more emotional, makes it more difficult to stay on an even keel. So, the important thing is to recognize that that's part of it. And that is something that in the beginning, just working on that mind control, learning how to calm the brain, learning how to reduce adrenaline, learning how to reduce the factors that are driving it, reducing the inflammation, and working toward restoring normal sleep patterns, reestablishing circadian rhythm. Again, that's something that I'm fairly immersed in right now. My condition was propelled by poor sleep. That's why I became ill in the first place, is because I had been taking every other to every third night call for about 15 years, and I lost the ability to sleep on the nights that I wasn't on call. And that's what propelled me into the whole thing. And it took me a long time to overcome that. And my sleep is something that I have to be very, very, very careful with. I'm very protective of my sleep. So that is something I'm working on, is to create a program to guide people through this process. Because when you look at fixing sleep, as far as herbs or drugs or anything else, there isn't anything. I can remember 15 years ago going, sooner or later they're going to have a drug that's going to fix sleep. It's going to, and this problem will be gone. I now know that sleep is so complex that will absolutely never happen. You have to address the causes, and you have to allow the brain to restore it to normal.
Well, in honor of your sleep and everyone on the East Coast, it's about time for us to wrap it up here. So anything to close with, Dr. Rawls, or?
Probably that. Yeah, that was a good question to close on, Tim. I mean, that's something I'm heavily immersed in, is brain health and things that we can do to help that. And if you look at brain health and neurological symptoms of any kind, you have to look at sleep. Sleep is such a key element into all of this, and so that is something that. Yeah, that is a task that I put in front of myself, is to find a way to help people understand sleep and how to really master that.
All right. Well, thanks for all your answers and sharing your time with everyone tonight.
My pleasure. Thanks everybody for staying with us, and we'll be back with more webinars in the future. Thanks, Tim.
Thanks, Dr. Rawls. See you on the next webinar, Dr. Rawls. I think that is about all for the evening. Do visit Rawls MD. Check out those Me Again stories inspired by folks, real people that have overcome Lyme, and check out the Lyme support directory as well for some support in your area. So thanks for being here tonight. Keep an eye out for the next webinar. It should be in early June, I believe. And we'll send you something to be able to tune into that. And everybody have a great rest of your evening. Good night.